some of the exciting career opportunities in psychology. Today, we are taking a closer look at one of the most well-known, rewarding careers in the field, clinical psychology. So, what exactly do clinical psychologists do? A clinical psychologist is a trained mental health professional who assesses, diagnoses, and treats emotional, behavioral, and psychological difficulties. Rather than simply giving advice, they use evidence-based therapies to help people understand their thoughts, emotions, and behaviors, with the goal of improving mental well-being and overall quality of life. Who do clinical psychologists help? Clinical psychologists work with people of all ages, including children, teenagers, adults, and older adults. They help individuals experiencing depression, anxiety disorders, trauma after difficult life events, overwhelming stress, relationship challenges, addiction, and personality disorders. Every person's experience is unique, so treatment is carefully tailored to meet each individual's specific needs. Their focus is not only on reducing symptoms, but also on helping people develop healthy coping strategies and regain confidence in everyday life. Where do clinical psychologists work? Clinical psychologists work in many different settings. You can find them in hospitals where they support patients dealing with physical and mental health conditions. They also work in mental health clinics, private practice, rehabilitation centers, community health service, and universities where they may teach and conduct research. No matter where they work, their mission remains the same: helping people improve their mental health and overall quality of life. A clinical psychologist's work involves several important responsibilities. They begin by assessing clients through interviews and psychological evaluations. After understanding the person's concern, they make diagnosis when appropriate and develop a personalized treatment plan. They provide therapists, teach practical coping skills, and regularly monitor the client's progress. Throughout the process, they adjust treatment whenever necessary to ensure the individual receives the best possible care. Assessment tools they use. To understand a person's mental health accurately, clinical psychologists use several assessment tools. They conduct detailed interviews to learn about the client's experience and concerns. They may also use standardized psychological tests to measure areas such as personalities, memory, intelligence, and emotional functioning. Behavioral observation helps them understand how a person behaves in different situations, while questionnaires provide additional information about the symptoms and daily functioning. Together, these tools help guide accurate assessment and effective treatment. Common types of therapy. Clinical psychologists use different types of therapy depending on each person's needs. One of the most common is cognitive behavioral therapy, or CBT for short, which helps people recognize and change negative patterns of thinking and behavior. Family therapy focuses on improving relationships and communication within families. Group therapy allows people facing similar challenges to support one another, while mindfulness-based therapists teach individuals to stay present, reduce stress, and manage difficult emotions more effectively. Clinical psychologists and psychiatrists. People often confuse clinical psychologists with psychiatrists, but they have different roles. Clinical psychologist mainly assesses mental health conditions and provides psychological therapies such as counseling and CBT. Psychiatrists, on the other hand, are medical doctors who are specialized in mental health. Because they have medical training, they can prescribe medications when needed. In many cases, clinical psychologists and psychiatrists work together to provide the best care for their patients. Being a clinical psychologist requires much more than earning a degree. It also requires a combination of knowledge, compassion, and professional skills. One of the most important qualities is empathy, which helps psychologists to understand and support their clients without judging them. Patience is also essential because healing and recovery often takes time. Strong communication skills help build trust and encourage clients to express their thoughts and feelings. In addition, critical thinking and problem solving enable psychologists to assess each situation carefully and choose the most appropriate treatment. Together, these skills help clinical psychologists make a meaningful difference in people's lives. How do I become a clinical psychologist? One may ask. Becoming a clinical psychologist takes dedication and years of education. The journey usually begins with a bachelor's degree in psychology or a related field. This is followed by postgraduate training such as master's or doctoral degree in clinical psychology, depending on the country's requirements. Students also complete supervised clinical placement to gain practical experience before becoming licensed to practice. Although the path is challenging, it is a rewarding career for those who are passionate about helping others. Clinical psychology plays an important role in improving mental health and well-being. Through careful assessments, evidence-based therapy, and ongoing support, they help people understand, manage, and overcome psychological challenges. Their work gives individuals hope, resilience, and practical tools for a healthier future. If you are interested in psychology or considering a career in mental health, clinical psychology is a profession that truly changes life. Thank you for watching, and don't forget to like, subscribe, and join us for more psychology content. See you in the next video.